Okay, we should be good to go then. Okay, so Gina will walk us through some of the mission, and then we'll talk about why fundraising matters, personalizing your fundraising center, linking to social media, asking for donations during a pandemic. Gina will be talking, our associate director will be talking about the mission. Pat, our development director, will walk you through asking about some donations during this pandemic, because again, we're trying to be careful, during the COVID-19 pandemic that's going on. And then later on, Jamie Jones, who is on our committee and has been a longtime volunteer and supporter, will join us briefly and talk about her experience as a top fundraiser. And then at the end, we'll go through some Q&A if you guys have it. But feel free to type it in the chat box as well. And as always, you can always email us. It is just walk@KomenNEOhio.org. So you can just hit respond to any of those emails that we're sending you. So with that, we'll talk about COVID real quick. As of the recording today, and as I'm talking to you, we are still planning for an August 15th event at Wade Oval and an October 3rd event in downtown Akron at Lock 3. So we're still keeping an eye on, as we all are, the news that is coming from Columbus and Governor DeWine, but we're also staying in contact with our local representatives too, with the City of Akron and University Circle, to keep everyone up to date. And as more information comes out, we will definitely filter that down to you. But as of today, we are planning for in-person events, and we're also, taking a look at what a virtual event might look like, or what our plan B might look like, and we'll provide more information as that unfolds. But I want to, right off the bat, let you know that we're still planning on in-person events for both Cleveland and Akron. And Gina, if you want to talk about the 4 pillars, I will mute myself.
Sure. So my name's Gina Chicatel. I'm the Associate Director for Komen Northeast Ohio. I've been with the affiliate for a little over 10 years, mostly focused on the mission work that we deliver in the community, which I'll go over right now. Andrew, next slide, please. So an estimated 40,000 women and men will die from breast cancer every year. I'm going to repeat that again. 40,000 women and men in the United States will die from breast cancer every year. Individuals who die from breast cancer pass away once the disease has become metastatic or stage 4, which means the cancer is spread from the breast to other parts of the body. What we cover in the next couple of slides will outline everything we at the local Komen affiliate are doing to help shrink this number and add to the more than 1.2 million breast cancer survivors who are living today. Next slide, please. So the combination of science, education, and direct help to people facing breast cancer has helped lead to a 40% overall decline in breast cancer mortality from 1989 to 2016. Komen has funded more breast cancer research over our history than any other nonprofit to date, second only to the US government. Komen focuses on supporting those with the fewest resources, the uninsured, the underinsured, and low-income women and men who are unable to access care. Komen and our local partners educate people about breast cancer where they live, work, play, and pray to empower them with information they need to make informed breast care decisions for themselves and as they advocate for others. Next slide. So the Komen mission is grounded in our 4 pillars, and you can see them on the slides. They are research, care, community, and action. On Walk Day, individuals will have the opportunity to see each mission pillar up close and personal in our dedicated interactive pillar tents. And each tent tells the story of what, how, and why we do what we do. It also brings home why the funds we raise through the walk are so important. Next slide. The first pillar is, of course, research. I mentioned earlier that we are second only to the federal government for breast cancer research, with an investment of over $1 billion. I'll say that again, $1 billion in research. Thanks to the generosity of our donors and supporters, we're funding life-saving research in all areas of breast cancer, from basic biology to prevention to treatment and survivorship. With continued support, this scientific research will address some of the most pressing issues in breast cancer today. Right now, our research is focused on identifying and improving methods of early detection. So mammography is the best tool that we have right now, but are there other tools out there that could potentially detect more, like 3D mammograms and tomography have been a recent addition to the healthcare systems and are more adept at detecting breast cancer at an earlier stage. Our research is also focused on ensuring a more accurate diagnosis, developing new approaches to prevention, and enabling personalized treatments based on breast cancer subtypes and the genetic makeup of personal tumors. We also continue to support all levels of breast cancer researchers, from established investigators and leaders in the field to young scientists and clinicians who will serve as the next generation of leaders. Our research dollars help support not only scientific research and clinical trials, but also research partnerships and collaborations, scientific conferences, and research education. So I've put a link on this slide, which you guys won't be able to access, but if you go to komen.org and just type in research in the search tool, you can get access to all the information you would ever need to know about what Komen has funded in the past, what we are currently funding, and what we hope the future of research will look like. Next slide, Andrew. So we are currently funding more than 60 research projects and clinical trials, primarily focused on metastatic breast cancer and racial ethnic disparities in breast cancer mortality. The reason why we are primarily focused on these two things is because this is what contributes to those 40,000 deaths that occur annually in the United States. Metastatic breast cancer is the breast cancer that kills. It's not a managed chronic condition. It is a terminal illness. So if we are able to figure out ways to treat and cure terminal metastatic breast cancer, that will then trickle down and affect every other person who's diagnosed with breast cancer at an earlier stage. Additionally, African American women and some other ethnicities, and specifically lesbian women, have poor health outcomes when it comes to breast cancer mortality. So if we are able to decrease those disparities in the racial and ethnic differences, we are able to get a decrease in overall mortality. I mentioned the Komen website earlier, but I'll just give another plug. There are a variety of 1 to 2 page fact sheets on the website called Research Fast Facts. It offers a whole host of information. There's specific research on BRCA and genetic mutations that contribute to breast cancer, immunotherapy, which is all the rage right now, precision medicine, triple negative breast cancer, and some other subtypes of tumors. Next slide. The second mission pillar focuses on care. This means our primary focus remains ensuring every individual, regardless of race, ethnicity, income, education level, or geographic location, has timely access to affordable, high-quality health care. The bulk of the work that we do at the affiliate level focuses on this specific pillar. Our care ensures all people have access to the treatment services they need to combat the disease while living longer, healthier lives. Next slide, Andrew. All of our services at the affiliate are entirely free, and those offered by our contracted partners are either free or low cost to the patient. We make sure anyone who reaches out to us for assistance receives personalized care, and our patient navigator assists with healthcare access issues, including appointment scheduling, insurance benefits, and pharmaceutical assistance. But our patient navigator can also help with things like rent, mortgage or utility payments, grocery assistance, childcare, elder care, housing, employment, anything that could affect a person's ability to access healthcare. Our on-staff patient navigator can provide that assistance. The navigator is also available to provide emotional support, not only to patients, but to co-survivors as well. In April, we launched a new free transportation assistance program. We're partnering with Uber Health to give one free ride per patient per week in the areas where Uber is offered. In the areas where Uber is not offered or it's not an option for individuals, we will provide free gas cards so they can at least put gas in their car to get to and from appointments. Additionally, we participate on local and state coalitions and advisory boards to help shape breast cancer programming services across the state. Next slide. Our third mission pillar is community, and it focuses on establishing a network of connected individuals so they know that they are not alone. Our in-person events emphasize the importance of community so that everyone who participates can leave feeling empowered and connected. Next slide, Andrew. At our affiliate, we offer a variety of events throughout the year to establish our survivor and metastatic patient communities, including the More Than Pink Walks, our annual Metastatic Breast Cancer Conference. We have an annual Breast Cancer Survivor Symposium, and certainly more recently, online educational opportunities and virtual conferences on a variety of topics important to breast cancer survivors and patients. We also have staff and volunteers available to provide in-person education at small and large community events. Next slide, Andrew. Last but certainly not least is our action pillar. So action focuses primarily on all of our advocacy and public policy initiatives. Many people do not realize the work we do in this arena, but it has shaped and impacted the lives of hundreds of thousands of patients and survivors across the country. We educate and persuade policymakers on the importance of our mission. We fight for patients' rights, and we give a voice and opportunity for many survivors and patients to do direct lobbying on our behalf. We advocate for increased government funding for critical patient support services and empower them with fact-based information and guidance to make informed decisions. Next slide, Andrew. Our advocacy efforts are facilitated at the federal level by the Komen Center for Public Policy, and each state operates within the affiliates that operate within the state. So we are very active at the state and local levels as well. We currently have 4 major policy priorities. The first one is to ensure access to affordable, high-quality healthcare. That includes protecting access to healthcare for all patients, because breast cancer, once you have it, it is a pre-existing condition. So if you switch health plans, they could, well, now with the ACA, but they could potentially kick you off a plan or not provide coverage. We support Medicaid expansion and expanded eligibility for the Breast and Cervical Cancer Project. And we ensure continued access to Medicaid coverage without burdensome restrictions. Our second priority is, of course, to advance breast cancer research. The federal government is the highest funder of breast cancer research. The third priority includes increasing coverage and access to breast cancer screening and diagnostic services. When the Affordable Care Act was passed, it guaranteed mammography coverage for individuals, regardless of their ability to pay, so no out-of-pocket expenses for mammography. But if a person needs a diagnostic test, they then could be on the hook for their co-payments or deductibles, and that could be very burdensome for individuals who are living paycheck to paycheck. Additionally, if you've been diagnosed with breast cancer, you no longer get mammograms after the fact, you get a diagnostic screening. So you would have to pay out-of-pocket costs for that as well. Right now, we have a bill that's been introduced that would provide diagnostic services at the same benefit as mammography coverage, so eliminating out-of-pocket costs for diagnostic images. And the fourth barrier is to reduce, or the fourth priority is to reduce insurance barriers to treatment. So that's to protect patient preferences and enhance coverage, including policies that would require oral chemotherapy drugs to be covered at the same level as the IV chemotherapy. You can sign up to become an advocate. The link is right there, but if you just Google Komen Center for Public Policy, the the website will come up. Andrew, can you show the next slide? So this is a screenshot of what the Center for Public Policy's website looks like. And you can take action on a variety of bills that we have introduced. If you look at the top right-hand corner, you can see the Access to Breast Cancer Diagnosis Act. That's what I was talking about when we're trying to get diagnostics covered at the same rate as mammography screenings. So you could take action by, once you click take action, you can send a letter to your legislator and let them know you want them to support or sign on to become a co-sponsor of that bill. Everything that we have policy-wise is on that front page of the Center for Public Policy's website. You can also sign up to become an advocacy insider, which means you will get our monthly policy newsletter with all of the updates you would need to know. And I believe that's it for me, but I will be around to the end of the webinar if anyone has any questions about the mission, the pillars, or what we do at the local affiliate to help out anyone who needs services or healthcare.
All right. Well, thank you, Gina. And as Gina kind of gave you the why of why we're doing all this fundraising, and you may have been familiar with the pillars. It's something new for us last year, so we're excited to really bring those to the forefront of our mission and talk about those even more than we did last year. I believe you should have been introduced for the first time last year with Research, Care, Community, and Action. But one of those things that I want to leave you with that Paula Schneider mentioned today, our CEO at Komen, was, cancer isn't canceled. So with your help and your fundraising, you're really supporting everything we're doing and everything Gina just talked about. So again, I really appreciate your support. And with that, I want to talk a little bit about fundraising and specifically in the More Than Pink Walk. So walk you through some of the toolkits and the how to edit your personal fundraising center and connecting to Facebook and all that. Before we get into the nitty gritty, I do want to give a quick shout out to our top fundraisers in Cleveland and in Akron. So Connie Morris and the Cleveland Clinic team are at the top in Cleveland. So I want to send a quick shout out to them. And then also to Judy Seeley, who is on our committee and has been a long time supporter and volunteer for us. And lastly, Kristen and the Cannon crew, she's also on our committee as well. So with that, I'll plug in too. If you guys are interested in volunteering, you can email us. We do have a committee. So I see Roseanne and Jamie and Erica, and there's many people on the call who are part of our committee. So again, a thank you to them and their volunteer hours. And in Akron, we have, Jane Ladd, who is, again, a volunteer, a longtime supporter for us. So thank you for getting off to such a hot start in both Cleveland and Akron. And we really appreciate it for our top teams and fundraisers. And then I want to give a shout out to our sponsors as we have them today, starting off with SwageLock. I see Joel Feldman on the call. He is on our board. He is the walk chair. And he's a big supporter of what we do, and we appreciate his leadership, and obviously SwageLock getting involved. They've been huge advocates of our mission. And Giant Eagle, whenever you go to the Survivor tent, there is a huge group of volunteers that Melinda from Giant Eagle always brings. So they have been big supporters again of us over the years. So we want to send a heartfelt thank you to both SwageLock and Giant Eagle. And, Mitchell's has been there for a long time, providing the ice cream that I'm sure most of you are aware of, and the city of Akron as gracious hosts down in Lock 3 area. So to start fundraising for the walk, it's a 3-step process. So the first step is obviously to register. Step 2, set your goal, and then share your story. Everybody's got a story to tell. And we want you to personalize your fundraising center. So we want to hear your story, and the people who give to you want to hear your story. So it's an important part of your fundraising center, making it your own and using it, as a tool to fundraise. So one of the points we wanted to make was you can see the difference in an updated personal page versus someone who does not. And it's a stark difference. So, just a simple thing is sharing your page and updating your personal information there, your story goes a long way. So um, getting into how to personalize your fundraising page, this is what you'll see, and I'll walk you through what it'll look like in real time. But this is what you'll see when you log in, and you have quite a dashboard here of social tools, email tools, editing your picture and your story. And then later on, we should have some fundraising tools in addition to that. So there is to edit your page and share your story is right there. Click the edit the page section, and I'll show you that here in a second. So again, customizing your personal page. We want to start with setting your goal and something realistic. I believe individuals start at 250, teams start at 2,500, and then move on to updating your photo and your story. And again, I'll show you how to do that here in a second. But you can really, it's a very intuitive tool and website that we've been given, and we want to use it to your advantage. So. And then they've given us badges too. So as you connect to Facebook, as you share your page, as you send emails, you'll rack up those badges. So those are pretty cool too. And here talking about email specifically, this is I love email. I don't know if you guys do, but the emails are pre-built. You can edit them using that Go Social tab and the email tab. But they all provide the direct link to your fundraising page. You can import your contacts in there, and it's a really cool tool. And maybe I'm weird that I get excited about email, but it's a pretty cool tool. And you can see there the difference again between individuals who send emails through the fundraising center and those who don't. There's a stark difference in between those two. And last, this is something new that just came on, is the More Than Pink Walk app. And this is something you can go ahead and download now. You can log in and you can do everything I just explained from this app. So you can edit your page and view your progress and send your messages. And something new is to deposit your check donations right within the app. So that is a really cool tool for us all to be using there. But before I show you how to connect to social media, let me see if I can walk you through this. So here is what the page looks like. Hey, Gina, can you give me a yes, or Roseanne? Can you still see?
Yes.
Okay, thank you. I want to make sure my internet is keeping up with all this. But this is I'm logged into the Akron page right now. So after you're logged in, you can click down and see your fundraising center. And after clicking on that, again, this is what will populate. And I just fundraised, so don't yell at me. Or I just set up my page, so don't yell at me. But here's what the dashboard will look like. I've already connected to Facebook. Otherwise, right here, it will ask you to connect. And then you scroll down, and here are the different tabs that you can click on that are kind of the hot links to update your page and photo. It takes you right to the email, or share or recruit your team members. So I do want to walk you through this because this is kind of a cool tool, and I think it's underutilized. So here, you can send fundraising messages right out of here. So if I were to click this, what should pop up is an email that is populated, and you can go ahead and type in whatever you'd like here to update that message. You can schedule messages. I won't go into that, but it's, again, very intuitive. You can click the select all messages there to do it. You can thank donors right from here. So it's a very intuitive tool on the fundraising side and the recruitment side. You can sit right in here and send messages from your email, Twitter, LinkedIn, or Facebook. And then lastly, what I was talking about was the emails. So here, I've got my contacts all here. And what I can do is email the selected. They will populate within here. And I'll get rid of Gina's because that is incorrect. But then again, you can start with your personalized message. So it populates in here, and preview and send that message. So it will personalize to the individual if you so choose. Otherwise, you can go in and edit that message. So it's a pretty cool tool, and you've got quite a few messages already here for you to use. And in addition to that, as I said, you've got your edit the page. So you can come back here and edit your cover photo. You can edit your photo and video here, your headline, your story, again, what I was talking about that is important. So it's a very intuitive tool here for us all to use, and I would encourage you to do that. So let me come back here. Let's see if I can bring, yeah, okay. So now I want to go into social media, and this is something that is new for us the past 2 years, bringing on Facebook and the ability to connect your fundraising tools there and do a lot of the fundraising through Facebook. So it is the easiest way to hit your goal. And Facebook fundraising, I want to read this out because it's important. Facebook fundraising must be set up for your walk fundraising center in order for it to work properly. So it will connect, and you can edit everything there. Again, I'll walk you through it here in a minute. But there is a huge difference, and I'll let Jamie kind of dive into her experience later on, but there is a big difference between somebody that is connected to Facebook and somebody who is not in the amount of fundraising that they've done. And then you get the cool badge at the bottom, which is a nice little perk. So it's 2 steps, as I showed you. Log into your fundraising center. If you're not registered yet, go ahead and register. And you'll be taken directly to your fundraising center. You'll scroll down and just hit Connect Fundraiser to Facebook. And again, in the bold letters, remember that Facebook fundraisers raise 3 times more than those who don't connect. And you can do this again from the app. We're showing the phone there. So you can also do this from the app there. And in addition to that, let me come back, because I did say I would show you the Facebook fundraiser. So this is what it will look like once you click that link. So this is my Facebook fundraiser for the Akron Walk. You can update the picture here, as I've done. You can update your goal and your goal amount, the end date, and then your story here. Again, personalizing what you did in your fundraising participant center. So it's very simple. You can share it here. So you've got your copy link. So if you want to send the direct link in an email or a text message, you can do that. So again, this is a great little tool that we've been gifted from headquarters, and they've been really supportive of what we've been doing. So encourage everybody to use that too. In addition to that, we do have these resources right at your fingertips. So they are on our website. And if you go to either Cleveland or Akron More Than Pink Walk.com, and you go to fundraising for the walk, as you can see here in the lower right-hand corner, it'll take you to this page. And here are, all the tools that you can use on your end. So everything from the app, if you want to download it, to your goal calculator, recognition and rewards, which I'll get into in the next couple slides. But there is a lot here that we can provide you to help make sure you hit your goal. And here we do have, in addition to what's on there, our team at Komen Northeast Ohio has put together a team captain info sheet. We have manual step-by-steps and instructions on how to use your fundraising center. So if you need that, you can print it out and use it alongside as you log in. And then a 1-page sheet for the 2020 Cleveland and Akron walks are on each of the sites too. And then lastly, hitting your goals. I do want to highlight this real quick. This is something new that we brought online last year, which is our fundraising recognition program. So I'll walk you quickly through this, that every team captain who has raised $1,000 at the 5-week mark for Cleveland, that is July 6th, they will get that team captain hat. And then all of the teams that have raised $2,500 or more will receive an invite to our special top teams area, our team tailgate area on walk day. And then all of our walkers who raise $100 or more, they will receive an event t-shirt, and all walkers who raise 1,000 or more are our top fundraisers and are invited to the VIP area as well. And you can see over to the right, there is the early activation stretch bracelet, which is at that 5-week mark. If you were to raise $100 or more, you would get that early activation bracelet and the team captain hat, again, that I just talked about, and working up, from $250 all the way to $10,000. There's a really cool tracker jacket that's there too. And this is on our website too, if you'd like to download the PDF for your reference later. But with that, I kind of ran through those pretty quick. But Pat, if you want to talk about soliciting the donations during this pandemic, we can continue the conversation on fundraising.
That's great. Thanks, Andrew. I'm Pat Egan. I'm the Director of Development, and I'm delighted to be here with you tonight. Next slide, Andrew, please. We've gone through the pillars. We've gone through some social media. But, it's really important to understand sometimes you actually talk to people. And it's good to know what the funds go for when you're speaking with someone, when you're writing your story, or when you're trying to recruit a team member. Knowing what Komen Northeast Ohio does locally in terms of patient navigation and transportation and those wonderful services, as well as all the research dollars that are trying to make a difference in the lives of individuals with a breast cancer diagnosis, is really important for you to know, because people do ask questions. They ask, why should I give? So we're hopefully providing you with some of those answers. But it's important that when you sit back and think, okay, now who do I ask for money? Now let's face it, we don't all love asking people for money. I do, because I'm a crazy person and I've been raising money for 30 years. But most people are a little bit reluctant. Don't be. Start with your inner circle. Ask them to make a donation. Ask them to join your team. If you start with your inner circle, those family, friends, neighbors, your book club people, your gourmet club, the people that you exercise with at the gym, when we get to do that again, those people you might walk with, those will give you early wins. And those early wins to really help you gain confidence in asking. You think, wow, I asked my neighbor and they said, well, sure, I'll give you $100. So, those early wins are really important for building your own confidence. Once you've asked your inner circle, you start to move out a little bit more. You can ask your colleagues at work. Again, those people at the gym, the people your family knows, your brother-in-law, your sister-in-law, those people that you don't see very often, the people who, come to your parties or come to your friends' parties, again, hoping that we get to do that again. Those are the kinds of folks that you can ask as well. When you're constructing your list for your contacts in your social media, in your emails, add those people as well. I find that asking people is not bad, and every once in a while you get a no, but no means now, not never. So as you get closer, you can ask them again. I only need $50 to reach my goal. Can you help me out? Next slide, Andrew. So how do you ask? The other thing that I really think is important is when you tell them that you're working for a cause that you believe in. Tell them your story, why you believe in the cause and who was affected and how it affected you. My story is that my sister is a 22-year breast cancer survivor. She is living a full, wonderful life. My grandmother, not so lucky. She died in her 40s. So because of those two things, I really feel like this is a cause I can believe in, and I can tell my story. I can talk about my sister and what a wonderful life she has now, how she's raised her children, because she is a survivor. And she is my story. I use my story on my social media. You can post your story on Facebook. You can use it on Twitter. You can use it in your emails. And again, when you start to personalize your story and you tell people that you're doing this because you personally believe that it's an important thing for people to do, you've changed the dynamic. Um, Volunteers and people who participate in events like this, when you say that you're volunteering or when you say that you're participating in something, you're not getting paid for it. You are doing something because it's part of your belief system. And it is a powerful, powerful message for those that you're trying to raise money with. Next slide, please. Don't be afraid to ask them to join you. Give a gift yourself. Start out by saying, hey, I gave a gift. Will you give me a gift? Any amount is good. No amount is too small. And if you're like me, no amount is too big either. So, don't be afraid. If they say, well, I don't know how much to give. What do you think? I always start out with something reasonable, $25, $50, or you might tell them what your goal is. My goal this year is to raise $1,000. I am at $500 right now. Can you help me out? And let them decide. If they really get inspired and you've really gotten them all fired up about your belief system, ask them to join your team. Again, as Andrew mentioned, we're working on a variety of ways to keep people safe at the walk, should we be able to do an in-person walk. So don't be afraid to do that. And teams really working together help each other out, and they really provide moral support, and they can share stories. I call them battle stories. This was a win, this not so much. But again, that team spirit is very important as well. And if they're even more inspired, ask them to create their own team. So there's a variety of ways that you can get them to join you. And again, a lot of it depends on your own personal comfort level. Again, tell them your story. And remember, if you don't ask, you don't get. Be fearless, be bold. And people are very, very generous, and they do care about those people in need. We serve a population that really requires support, because many of them don't have personal transportation. They don't have access to health care, and a lot of insurmountable issues surround them. So when people know that, they are generous and they consider themselves very privileged to be giving. And you are the instrument from which they can give. You can make them feel good. You can make them feel a part of this community. But remember, you gotta ask them. And thank you so much. Good luck.
Thank you, Pat. Okay, I thought it froze there. So the last little bit we have is to bring on Jamie real quick, and we'll talk through some of the things that she has done. Jamie is on our engagement committee. She has been co-chair of our leadership committee and a longtime supporter and volunteer for the organization. So I will preface real quick. That is a picture of Kristen from Cannon's crew. That's not Jamie, but with that, I'll turn it over to Jamie real quick.
Hi, can you hear me okay?
I can hear you.
Okay. I just wanted to reiterate a couple of points that were made. The first one, that Pat just drove home is, don't be afraid to ask. And even further than that, don't be afraid to ask more than once. I'm a procrastinator by nature. I know a lot of my friends are. So a lot of people, when I ask the first time, they're like, oh, it's not until August. I've got plenty of time. And then things happen in life. They forget about it. So just don't be afraid to ask more than once if need be. The other thing that I found to be successful for sure is the fundraiser through Facebook. More specifically, the birthday fundraiser. So if you have a birthday that's anytime soon and are able to link up Komen for the birthday fundraiser, the last 2 years, each year I've gotten almost $1,000 just by doing that. You know, peer pressure is a really good thing when it comes to Facebook and the fundraiser. So make sure you link that up. And the other thing that's really been helpful is if you have your fundraiser, the participant center, it'll show you who all have been your past donors. So make sure that you reach out to those people who have, you know, contributed in the past. They may not know that there's a race going on. They may not be on Facebook. And a lot of the people, when I ask, they're, oh yeah, you know, I do remember that. I want to go ahead and donate. How can I do that? So, you know, that's the big thing, again, like what Pat was saying, is just don't be afraid to ask and to use the different platforms to do that.
All right. Well, thank you, Jamie. And in addition to that, we've seen participants throw parties. Diana Fretwell, who is a large fundraiser for us in the Akron area, did a casino night every year. It's kind of changed this year and gone virtual. But that's an idea too, is hosting a fundraising event or party. And we have seen some people doing that virtually now through Zoom, as we've seen many other meetings go. But you could also get a local business to sponsor your team. And Anita Abu did that in Akron as well, and was our top individual fundraiser down in Akron last year. And both of them were very successful, you know, doing those two very different things. So there's a variety of ways to get your fundraising rolling. And then lastly, obviously on our website, we have the paper registration forms, but you can obviously send them the link to register to get them involved, but bring the registration forms to family events and maybe get them involved that way. So those are just a couple of things that we had. Lastly, I do want to say thank you to Jamie for speaking tonight and for her volunteerism over the years, along with a quick shout out going down the list, because there's Roseanne, who is also on the engagement committee this year, and co-chaired the walk committee last year. Erica, I see you are on here twice, but I see Erica's on the call, and Christina from our board. So quick shout out and thank you to everybody who has been so supportive of us. Dina, sorry, I didn't mean to hop over you, but she has been, you know, a huge supporter of us too. So again, your support goes a long way to what Gina was driving home earlier with our mission. And with that, I will take any questions that you might have. Again, you can type them in the chat box. Feel free to unmute yourself if you'd like to ask the question. We will also be posting this to the website, so if you want to rewatch any of these things, and then email us at walk@KomenNEOhio.org, you can do that as well. With that, was there any questions tonight? All right. Well, I just typed, yeah, thank you, Allison, for showing up, and we've been playing phone tag, so I'll get you a phone call so we can chat on the phone. But I've typed in the email there, so if you want to copy and paste that, if you have any questions moving forward, don't hesitate to reach out. We're all working remotely, and we are, you know, in front of our computers for most of the day, so don't hesitate to reach out to us. So thank you again for joining us, and I'm sure we'll be talking soon as we move forward. We'll try and do more virtual events to get people involved. So thank you and have a good night.
Thanks, Andrew. Thanks, everybody.
Thank you.
Thanks, Joel.
Yep.